And today, Sir Bruce Keogh, who's the medical director of the NHS, and I are launching a refresh of a cardiovascular programme to see if we can get more people aware of their blood pressure and what could be done about it. So, there are 5.5 million people today in England who have undiagnosed high blood pressure, and about 500,000 people that have atrial fibrillation, and they don't know it. And the message is, if we could get people to be more aware of blood pressure, then we could get more people into treatment that would help and avoid a heart attack or a stroke at a later date. If I asked you, particularly the men in the room, do you know what your blood pressure is, would you be able to say? I don't believe you. I mean, that's I think if I had a group of men in New York and I asked them, they would know. And because they're heavily incentivized. If you're fortunate enough in the US to be part of a health program, they know that this matters, and they pay attention to this. We have like a glorious system relative to the US, but we don't have that sort of incentive, and it's not a conversation that we tend to have. So if I asked you in the room, how many of you know your PIN number? I don't expect you to share your PIN number, but I do want you to share your blood pressure number. So when we think about living well, living in good health for longer, there are things that the NHS can do that will make a difference. Very engaging, not expensive, but just getting people more aware of this. Smoking, the position nationally is the best it's ever been, second best preference rates in Europe. But we still have 1 in 5 people smoking, and we still have great variation, particularly with people who have a mental health problem. But differences all over the nation about rates of smoking. There's still more to do. So complacency about this would not be the right place to be. Again, with the NHS, yesterday talking to them about what they could do to help people stay well for longer. 1 in 4 people that occupy a hospital bed smoke, and less than 1 in 13 of those will have a conversation with a doctor or a nurse or any healthcare professional about why that not be a good plan. I think 1 in 4 people in 2017 today in a hospital bed that smoke is really quite shocking. As an opportunity for the NHS to pay attention to this. It doesn't cost anything. It's us saying, there is help available, and directing people towards that. Some great examples of hospitals, particularly mental health services, paying attention to this, but it's still only 1 in 10 hospitals that are paying attention to this.